I had no way of knowing that my condition could be cured. I was depressed and feeling that this is how I had to live the rest of my life out, with constant pain walking in my left calf. And Dr. Teichman changed all of that. I'm a very active person. I do not have diabetes. Apparently, my problem results from peripheral artery disease, lack of adequate blood flow in the legs, lower extremities. The left leg began hurting me probably 10 years ago. When I would ride a bike or swim, I would get cramping, and it was very, very painful, and eventually it got to the point where it was hard to walk. I used to run 20 miles a week for 20 years or so, and to not be able to walk adequately did not make me very happy. It made me depressed. It made it so that I didn't want to walk 2 blocks to my son's house. It would hurt me. Everybody else would go out walking, and when I went walking, it would be just pure pain. And that is not a way to live. I had 4 arteriograms in an effort to open up the blockage down in my calf, but they all could not get past my knee, because in the back of my knee, apparently my arteries are twisted. My family told me there's got to be someone out there that could help me. And I was depressed because I couldn't find anybody and didn't know of anybody. 4 different doctors tried to alleviate the condition, and no one could.
This started with a fungal infection in your toe?
It started with a fungal infection between 2 toes, and it did not get any better. As a matter of fact, it got worse and worse and worse, because I did not have adequate blood flow to heal it. I went to see Dr. Teichman. I told him that no one could get past the knee. He said, unless you get blood into your toes, you will not heal. And I said, well, no one could get past it. And Dr. Teichman told me that he knew of a doctor, part of a limb salvage team that he works with, Dr. McGuckin. So I went to him, and he put 3 stents in my lower leg, and it immediately increased the blood flow. The flow was so strong that apparently it activated bacteria, or the bacteria from the infection, and made the infection worse. They started to get redder, the toes got redder, the foot got redder, and then some blackness appeared, and it was kind of very scary. The toes got black, the one toe in particular, the 3rd toe, and it kind of spread to the 4th toe, nearest the little toe. He said it was kind of a double-edged sword. The procedure by Dr. McGuckin activated the infection, but also it was necessary to increase the healing. Dr. Teichman came in, and he said my toe and possibly the toe adjacent to it would have to be amputated. I was visibly shaken and not too happy. It's something I had never expected from a condition in my toes, a little infection. The MRI I had in the hospital subsequently showed the infection had not spread to the bone. If it had, the toe would have to be amputated. It made me extremely relieved. It took this fungal infection for me to go to a podiatrist to treat it. And if I hadn't gotten this infection, I would have never known about someone that could help me. I'm back to normal, and I do the elliptical, bike, treadmill, I swim, I do weightlifting, and I bike outside. I am good to go now, and I am taking up a walking program where I'm walking a lot more now, and very happy that I can walk. I would say, Dr. Teichman, you have given me a new lease on life, because before I came to see you, I had no quality of life, and I am very grateful and just want to thank you from the bottom of my heart.